My name is Rachel. The doctor has ordered a peripheral IV, so I'm going to grab all of my materials I need. I'm going to check the physician's orders for the size of the IV. I'm going to make sure I have all my materials, and I'm going to go into, before I'm going to check for allergies and previous surgeries preventing an IV on either side of the patient's arm. So, good morning. My name is Rachel. I'm your nurse today. Your doctor has ordered for me to insert a peripheral IV. Can you tell me your name and date of birth?
Sally, February 7th, 1975.
Thank you, Miss Sally. Do you have any allergies?
No.
No? Okay, so, and which is your non-dominant hand?
Left.
Left. Okay. Do you have any previous surgeries or shunts placed that would prevent me from doing anything to your left arm?
No.
All right. So first I'm going to lay out all my materials. I'm going to make sure I wash my hands. I'm going to then apply my tourniquet. I have previously primed my extension tubing, hooked my saline flush up to it. I'm going to look for a good, resilient, bouncy vein. I'm going to go right here. I'm going to clean the area with alcohol. While that's drying, I'm going to place my gloves on. Alright, so then I'm going to take my 20 gauge IV catheter. I'm going to pull the vein taut, go in at a 15-degree angle. Miss Sally, you're going to feel a big stick. Advance the needle in until I get a blood return. I see blood, advance the needle a little bit more, then advance the catheter while taking the needle out, holding above. I'm going to grab my extension tubing, secure it onto the hub of the IV. I'm going to pop my tourniquet, unclamp the extension tubing, pull back for a blood return. I see blood, and flush with 3 cc's of saline using the push-stop method. Miss Sally, you doing okay?
Yes.
Alright. Alright, so 3 cc's. I'm going to reclamp my IV tubing while holding pressure on the flush. I'm going to unhook my saline flush. Grab my Tegaderm, apply the Tegaderm, leaving the hub available. Take off the label, and then I'm going to tape down the rest of the tubing. Alright. I'm going to initial, date, and write the gauge on the label and stick it back on the Tegaderm. And then I'm going to clean up my area, dispose of my sharps in the correct container, clean up my area, and then Miss Sally, if you feel any redness or tenderness or swelling in your arm, I need you to call me immediately. And then I'm going to document the time, date, how many sticks, the site I placed the IV, and how the patient tolerated it, and any special instructions I gave the client.